Bismillahirrahmanirrahim. Assalamualaikum and a very good morning to our lecturer, Mr. Akmal Nasri, and fellow classmates. And also, I think it's not too late to say Selamat Hari Raya Idul Fitri, Maaf Zahir dan Batin to all. Alhamdulillah, all praise to Allah Subhanahu wa Ta'ala. We are gathered here this morning for an insightful presentation from us today. Firstly, allow me to present in bilingual, in English and Malay. Without further ado, my name is Haji Muhammad Karizam bin Suleiman, UBD registration number 24L9022. And with me today are my group member, Cikgu Nur Sadiah and Cikgu Leni, where they will present their part on today's topic, ethical dilemmas and professional challenges in counseling. This presentation is part of our course Effective Counseling in Communities and Work, CEB 4001. Together with my group members, we will explore the most common ethical dilemmas faced by counselors and how this should be handled professionally. Okay, let's begin with the learning objectives. By the end of this presentation, you should be able to understand the importance of ethics in counseling, identify common ethical dilemmas in counseling practice, analyze how ethical dilemmas impact decision-making and client care, apply professional ethical decision-making models, reflect on personal values, biases, and cultural competence. What is ethics in counseling? Ethics refers to moral principles and standards that guide a counselor's conduct, ensuring they prioritize client well-being, maintain confidentiality, and act with integrity and competence. Why ethics are important? It is for client protection, to prevent harm and ensure quality support. Building trust, a safe and a supportive space builds trust. Professional integrity. Ethics protect the dignity of our profession as a counselor. Next is effective practice. Ethical practice lets us focus on our client's need without compromising our values. So here are the professional organizations, some of the professional organizations that are available around the world. Firstly is the ACA, American Counseling Association. Next is PERCAP, that is Brunei Darussalam Counseling Association, and then Lembaga Counselor, Malaysian Board of Counsellors, PERCAMA, International Counseling Association of Malaysia. Okay, so let's see some of the code of ethics of this organization. Okay, let's see. Firstly is the American Counseling Association. It is the ethics, the code of ethics are autonomy, beneficence, non-maleficence, self-respect, fidelity, justice, and veracity. Whereas from our side, Brunei Darussalam Counseling Association Code of Ethics 2018, the Code of Ethics are scope of counseling, code of conduct, research and publication, supervision and training, assessment and measurement, handling ethical violations, distance counseling, technology, and social media. Next is the Malaysian Board of Counselor Code of Ethics. The Code of Ethics are helping relationship, confidentiality, privileged communication, and privacy, professional responsibility, the relationship with other professional, assessment, evaluation, and interpretation, supervision, training and teaching, research and publication, and lastly, resolving ethical issues. So let's look at the similarities and the differences between ACA, PERCAP, and LKM. So for the similarities, all of three emphasizes core values such as autonomy, beneficence, non-maleficence, fidelity, justice, and veracity. And then next, the importance of maintaining client confidentiality. Lastly, requires ethical use of assessments, emphasizing on accuracy, transparency, and client understanding. The differences between the three are the ACA code is more universal, whereas PERCAP and Malaysia Board of Councillors code is more locally contextualized, adapting to each country's legal legislation, norms, and cultural practice. Okay, for example, PERCAP was established in 1983. So at that moment, we don't have the code of ethics ourselves. So we use the ACA and LKM and Perkama as our guide for the code of ethics. So Alhamdulillah, in the year 2018, we have our own code of ethics from Perkap. So we use them as a guide also. Okay, so next. Okay, so we go to ethics and technology. So according to the ACA Code of Ethics to 2014, counselors must ensure clients understand the limitation of digital services, including potential risks to privacy and data security. Counselors must handle confidentiality, consent, and boundaries carefully when using social online platforms. Importantly, counselor must be equipped to identify and resolve ethical issues using professional codes and thoughtful judgment. Okay, research by Zur 2017 and Barnett 2018 emphasizes the importance of developing digital competence to navigate ethical dilemmas unique to online interaction. So during this era, so technology era, so we as a counselor must handle this situation very seriously, and we must take the confidentiality because di sana ada spammers and then malwares and then scammers, so they can ambil information lah from the internet. Okay, so next I'll pass to my other member, Cikgu Nur Sadiah Matasat, for her part. Thank you.
Thank you, Cikgu Haji Khairul Izam. Now it's my turn to discuss and share some common ethical dilemma and challenges that counselors face in their work. Counselors are expected to follow professional ethics. Counselors need to make careful decisions to help their client while staying professional and respectful. In real life situation, it's not always easy to decide what to do. Now I want to highlight some common ethical dilemma in counseling. Next. Counselors are bound by confidentiality. Confidentiality is key in building trust with our client. However, when a client reveals their intent to harm themselves or other, we face with a difficult decision. Should we protect their privacy or alert authorities to prevent harm? This dilemma required balancing ethic, legal obligation, and the safety of everyone involved. The second ethical dilemma is dual relationship and boundaries. Next slide. Next. The second ethical dilemma is dual relationship and boundaries. The situation is that counselor may know the client outside of the session as relative, friend, or co-worker. This is called a dual relationship. It can make it hard to stay professional and unbiased. Therefore, counselor must set clear boundaries to protect both the client and the counselor, so both of them can feel safe and respected. Next, cultural sensitivity and bias. In some scenario, counselor may meet client whose lifestyle or belief against our belief, like drinking alcohol or being in a same-sex relationship. So we as a professional counselor must remain respectful, non-judgmental, and client-centered, even if we personally disagree. Next. Our client may also raise issues like polygamy. In such cases, counselor must be aware of their own opinion and avoid letting personal view that can affect the counseling process. Next, general interaction is also important. A counselor may be asked to see a client of opposite gender. This may cause discomfort, but it is important to remain professional while respecting cultural and religious boundaries. Next is informed consent and competence. Informed consents mean the client know their right and the counseling process. The counselor must ensure that the client understand the nature of counseling process, confidentiality, and the limit of confidentiality. Next, but in some cases, if it can be more complex when our client don't speak the same language or even read well, making it is difficult to explain the counseling process and obtain informed consent. The last ethical dilemma I want to raise is scope of practice. We must only provide services within our scope of expertise to avoid harming client. If the issue is outside of the counselor expertise, they should refer the client to another counselor or expert. In brief, I want to share the challenges that we face in our daily work. Okay, next slide. These include emotional stress, heavy workload, and the need to keep update with new technique. All of these challenges and pressure can affect how well counselor can support their client. First, we may feel mentally and emotionally tired after listening to many difficult stories. For an example, a counselor working with trauma survivor like victim of domestic violence or abuse may start feeling emotionally overwhelmed and unable to separate the client pain from their own life. Second, a counselor has to maintain personal boundaries. For example, a university professor who is also a counselor is asked to provide therapy to a student in his class. There is a risk that a student might feel pressure or expect special treatment from the professor. Next, other than that, a counselor also may face situation where the client do not want to participate in the session. Next, a counselor must also stay updated with new counseling technique, including online therapy. Last but not least, okay, having too many clients at once is also a challenge. For example, a school counselor may be responsible for hundreds of students, making it hard to give each person enough attention. Okay, now, what are we going to do when facing a difficult ethical issue? Okay, next slide, Chico. Okay. Counselor can follow a 7-step ethical decision-making model. First, by identifying the ethical dilemma. For an example, a 16-year-old client tells the counselor about abuse at home, but asks the counselor to keep it a secret. So the counselor must decide between keeping the client trust or reporting the abuse to protect them. In this case, what should we as a counselor do? Should confidentiality or safety come first? The second step is to check the professional code of ethics. In Brunei, we can refer to Persatuan Counseling Brunei Perkap Code of Ethics. Number 2, Brunei Counseling Ethics Code issued by the JPA in 2023. Counselor Code of Ethics issued by the Department of Community Development, JAPEM, in 2023. For example, Brunei Counseling Ethics Code issued by JPA code that the confidentiality principle has exception when a client is at risk of harm, as in cases of child abuse. Next, the third one is to think about the law. Some ethical dilemma also involve legal aspect. Under the Children and Young Person Act 2010, code that any form of abuse, neglect, or exploitation of child is a criminal offense. So counselor have a legal obligation to report child abuse to the Community Development Department, JAPEM, or to the police. If a counselor fail to report a required cases, they may face legal consequences. The fourth step, once the ethical issue is identified, the counselor must assess possible courses of action and their consequences. 4. Next, counselor also should not make complex ethical decisions alone. Instead, the counselor should ask for help from a professional supervisor, experienced colleague, and to the ethic board. Next, after getting advice, the counselor must choose the most ethical course of action. Finally, next slide. Okay. We write down what we did and why. Documentation help protect counselor from potential legal consequences. Okay. Without further ado, I pass the floor to Cikgu Leni.
Okay. Bismillahirrahmanirrahim. Thank you, Cikgu Sadia. Assalamualaikum, good morning, and selamat Hari Raya to Sir Akmal and my classmate. I'm Leni Fadlina binti Wahid with registration number 24L9021. Okay, I will be continuing presenting on 2 case study regarding our topics on ethical dilemmas and professional challenges in counseling. Our first case study is with the title that line that blur when counselor and client share a social circle. In Malay, garis yang kabur apabila counselor dan klien berkongsi lingkungan sosial, which is will be explore how dual relationship can complicate counseling and how to navigate these challenges ethically, especially in close-knit communities, which is community yang rapat. Okay, next. Learning objective is to identify ethical challenges of dual relationship. Number 2, apply ethical principle to boundary related dilemmas. Number 3, develop strategies to manage dual roles. And number 4 is reflect on personal and professional boundaries. Okay. First, meet Mr. Razak. The first case study is meet Mr. Razak, a counselor in a small town, receive referral from Nurul, someone he knows from a shared religious, which is a social circle. Okay. She's no close friendship, but occasionally interaction and ethical dilemma accept or refer. Okay. Next, ethical dilemma. Should Mr. Razak accept Nurul as a client or refer her to another counselor? What factors must be considered? Okay, next. Let's break down the ethical codes involved, which is 4. Number 1 is dual relationship. According to ACA Code A5D, we must avoid relationship that could impair our judgment or risk harm. The second one is boundary management. Sometimes dual roles are unavoidable. If so, steps must be taken to protect the client's welfare. The third one is client autonomy. Client, like Nurul, have the right to make an informed choice. And the fourth one is cultural sensitivity, which is for client from specific cultural or religious communities, a counselor from the same background might feel safer and more relatable. Okay, next. Resolution process. There are 4, which is Razak doesn't act immediately. He goes through a deliberate process, which is first is self-reflection. He checks in with himself. With this affect his objectivity. The second one is consultation with supervisor, which is he speak with a supervisor to get a second opinion. The third one is informed consent. He reach out to Nurul and transparently explain their social connection. The fourth one is risk assessment. He weighed the risk, harm, confidentiality issues, and the availability of cultural appropriate alternative. This is an excellent model for handling any ethical gray area. Okay, outcome. Okay, Nurul chooses to continue with Razak, appreciating his understanding of her culture and his professionalism. They agree on clear boundaries. And no therapy talk outside session, absolutely confidentially in social setting, regular supervision review to maintain boundaries, and everything is documented and both counselor and client are on the same page. Okay, next. Analyze table. This table summarizes how Razak applied key ethical principle, which is dual relationship, were acknowledged and discussed openly. Autonomy was respected by letting Nurul decide. While cultural competence, a strength, the therapeutic alliance, and the fourth one is non-maleficent, guided Razak action to prevent harm. Okay, next. Discussion question. Can dual relationship be ethical? Number 2 is what risks are involved and how. The third one is how does contact urban versus rural affect decision? Okay. Next is extension activity. Boundary mapping exercise. Okay, now it's your turn in group map out your own professional and for personal overlaps, identify risk and managing strategies, and reflect in small group. Okay. Conclusion. Dual roles aren't always avoidable. This case shows us that ethical counseling isn't always black and white. It also intentionally being self-aware, transparent, and consultation. Dual role can be navigated, but only when we prioritize our clients' safety, autonomy, and trust, which is in case dalam kes ini memerlukan niat yang jelas, kesedaran diri, ketulusan, dan konsultasi. Hubungan dua hala boleh diuruskan, tetapi hanya jika kita mengutamakan keselamatan, autonomi, dan kepercayaan klien. Okay. The second case case study overview. Okay. Let me introduce you to Miss Sarah, which is a licensed school counselor. She has been supporting a 17-year-old student named Amir who is struggling with depression and anxiety. Okay. What is ethical dilemma? Uphold confidentiality or act for safety. Next. Okay, ethical principle. Sarah wants to uphold Amir's trust and confidentiality, but she's also responsible for his safety. This is where ethical principle may seem to clash. Okay. On one hand, keeping things confidentially is critical to building a safe space for clients. So what should Sarah do? Let's break this down by looking at the key ethical principle, which is confidentiality. According to ACA code A2A, counselor must protect client disclosure to foster openness. Second is duty to warn or protect according to ACA code B2A and B2B. When a client poses a serious risk to themselves or others, confidentiality may be breached to prevent harm. And then the third one, inform concern with minor. According to ACA code A to D, from the start, counselor must explain that confidentiality has limits, especially in cases involving safety. Next, resolution process. Clinical judgment assessment. This is how Sarah handled the situation responsibility. Step one is clinical judgment. She conduct a brief suicide ideation assessment and explore Amir's protective factors like friend, faith, and future goals. Step two, consultation. She consult with her supervisor to ensure her decision was ethical, legal, and well documented. Step three, therapeutic disclosure. She spoke to Amir gently, saying, I care about your safety. While most of what we talk about stays private, I may need to involve someone to help you stay safe. I'll be right here with you every step of the way. And the fourth one is parental involvement. Sarah arranged a meeting involving Amir and his parents. She explained the situation without exposing unnecessarily private detail. She referred them to a clinical psychologist for further care. Next, outcome. Okay. At first, Amir was hesitant, but once he realized Sarah wasn't trying to betray him, but instead was acting out of genuine concern, he agreed. His parents were initially shocked, but ultimately thankful. With support in place, Amir began regular therapy and a safety plan was developed at the school. Okay. Amir agrees to inform his parents and then refer to clinical psychologist and shows improvement and graduates successfully. Okay. Next, analyze table. Let's analyze how ethical principles were applied here. Okay, confidentiality maintain until safety become a concern. The second one is beneficent. Sarah act in Amir's best interest to prevent potential harm. Non-maleficent, by disclosing with care, she helped avoid harm, suicidal risk, and autonomy. Amir was involved with the decision, preserving his dignity and trust. This case highlights how ethical action doesn't mean choosing either or, but rather working in a way that balance and honor both principles where possible. Okay, next. Group discussion. Okay, group discussion question. Number one is, what are the risks of keeping Amir disclosure confidential? And second one is, how would this change with a younger child? And the third one is, how to rebuild trust after breach confidentiality. Okay. And the extension activity, role play, exercise in a group of 3 counselors, student, parents, and then act out the conversation, reflect on communication and emotional response. Next is, as a conclusion, balance ethical duties and compassion, safety and trust are cornerstone of ethical counseling. Which is, kes ini menunjukkan bahwa menjaga kerahasiaan adalah penting, tetapi keselamatan lebih utama. Dengan persetujuan maklum yang jelas dan komunikasi yang penuh empati, kaunselor boleh membuat keputusan yang tepat tanpa mengorbankan kepercayaan. Okay. Next. Okay. Key takeaways.
Saya punya juga.
Okay.
Okay.
Sorry. Okay. I will pass to Cikgu Ajizam. Okay.
Okay.
Thank you.
Thank you, Cikgu Leni. Kalau akan sambung, boleh juga. Okay, so I'll move on the key takeaways of what we present today. Ethics is foundational, where it ensures client protection, fosters trust, guides actions, and upholds the integrity of the counseling profession. Next, cultural and religious contexts matter, especially in multicultural countries where counselors must navigate tension between personal beliefs and professional duties. Next, case studies help bridge theory and practice, illustrating real-world application of ethics in sensitive situations. Lastly, self-care is crucial. Challenges like emotional burnout, high caseloads, and professional isolation affect ethical judgment and counselor well-being. So overall conclusion, in counseling, ethics is more than a set of rules. It's a commitment to doing what is right, fair, and caring in every client interaction. By grounding ourselves in ethical principles, codes of conduct, and professional values, we create safe spaces where client can grow, heal, and trust. Ethical practice is not only our responsibility, but it's our promise to those we serve. Okay, so thank you for listening. So we are welcome for any question or thoughts that you would like to share. So that's all from us. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.